Good morning, everyone.
Yeah, I'm supposed to speak today because you got a damn time. Yeah.
The appointed hour has arrived, so I think we should get started. My name is Dan Seeger. I serve as president of NaCCRA, the National Continuing Care Residents Association, which is sponsoring this meeting. Our theme this morning is engaging residents in CCRC life. As I'm sure everyone here is aware, the initials CCRC stand for Continuing Care Retirement Community. Although there is no officially approved definition of what exactly a CCRC is, most of us have an intuitive grasp of the concept. A CCRC is a residential community designed for older people, which allows them to continue to live active, productive lives while also having ready at hand standby assistance for the afflictions of age as they arise. So in addition to housing for these active seniors living independently, there exists in these same communities a health center which incorporates assisted living services and a skilled nursing facility, providing a continuum of care. Such community living gives older people the social advantages of collaborating in maintaining a cultural life, recreational activities, educational programs, and participation in political life while sharing the costs of health services, fitness facilities, housing, and dining services. Conceptually, it is one of the most comprehensive approaches to retirement living, and therefore, in the view of many of us, the optimal one. Yet the CCRC industry is a new industry, having only been invented as recently as the 1970s. CCRC residents are financial investors in this new industry. We are engaged in and are supporting with our dollars a new industry which is highly complex in nature, which as long as it works fills a vital need, but which in many respects is still being invented. There are new contracts, arrangements, acquisitions, and consolidations occurring every day, all the while the industry faces a variety of challenges. Now, CCRC marketing departments often portray CCRCs as resorts, emphasizing their golf courses and swimming pools, implying that CCRC life is an endless, worry-free vacation. Yet residents' own experience contradicts this vacation-like image. They can experience arbitrary changes in the scope of services, making conspicuous their legal powerlessness with respect to the managements which their dollars are paying for. There are the occasional bankruptcies and the attendant publicity which tends to give the industry a bad name, placing the future of all of us at risk. And there are general questions about the adequacy of industry-wide financial practices. All these and other factors indicate that lapsing into a strictly vacation frame of mind would be practically unwise, if not unhealthy and unworthy, as a formula for dignified living. The fundamental premise upon which the National Continuing Care Residents Association is based is simply this: it behooves us as investors in a new, complex industry to engage in a process of collective learning. We will never thrive if we remain isolated from each other and reinvent the wheel again and again. And in addition to collective learning, it behooves us to engage in collective action when proper defense of our interests calls for it. The purpose of NaCCRA is to serve as a vehicle, working to preserve and strengthen the CCR way of life by empowering those who have invested heavily in it and by facilitating their actions of mutual support. This morning's program gives expression to this mission. We have three excellent panelists, each of which each of whom is qualified to offer us the best thinking available about resident engagement in CCRC life. I will introduce the three people now, and then they will speak in turn. Each will speak to us for about 15 or 20 minutes, so there'll be plenty of time for questions and discussion at the end. Our first speaker will be Professor Catherine Pearson, who is a member of the faculty of the Pennsylvania State University Dickinson School of Law, located in Carlisle, Pennsylvania. She is a specialist in elder law and is the author of many scholarly papers in that field. She will speak to us this morning about the importance of fiduciary sensitivity on the part of CCRC residents and the importance that this has for resident life. Next will be Jennifer Young, who for 37 years before her retirement worked in human resources for the banking and oil industries. She is now a resident of Meadow Lake CCRC in Tyler, Texas, part of the Sears Methodist chain of institutions serving the elderly. Sears Methodist Retirement Systems recently filed for Chapter 11 bankruptcy protection, and Jennifer, as a resident activist, will share with us some of the meaning the term resident engagement can have when trouble strikes. And finally, Jack Cumming will speak to us. Jack is a resident of Carlsbad by the Sea, CCRC in Carlsbad, California. He is a consulting actuary at Independent Actuaries and has had a long career as an executive in the insurance business. He is Director of Research for NaCCRA and operates our highly regarded website, Learning Center, which you can Google your way to as NaCCRA University. So first we'll hear from Professor Catherine Pearson.